So the suprasternal notch is located here, just on the superior border of the sternum, sometimes referred to as the jugular notch. You can palpate it between the sternoclavicular joints. So these are the prominent joints. There's one there, and the other one is there just underneath my middle finger. If we then move down from the jugular or suprasternal notch across the anterior surface of the manubrium, we feel the ridge there, which is called the sternal angle or the angle of Louis. So that's in line with the second rib. So if we come out here laterally, we can feel the costal cartilage of the second rib. Here?
Yeah.
So I'm now palpating the sternoclavicular joint. So we can check the movement at that joint by asking the patient to shrug his shoulder up towards his ear and relax, and again and relax. So you want to think about the movement that occurs at that joint. Of course, as the patient elevates the shoulder region, so the lateral end of the clavicle elevates, then the medial end of the clavicle is going to depress. We continue our palpation along the shaft of the clavicle, so you're thinking about the curve in the medial half of the clavicle versus the curve in the lateral half of the clavicle. As I move out here to the lateral end of the clavicle, I can feel the bony prominence of the lateral end where it's articulating with the acromion process of the scapula. So again, we can check the movement by asking the patient to elevate his shoulder towards his ear, so just shrug up and relax, and shrug your shoulder up towards your ear and relax. So again, with this movement, the lateral end of the clavicle is elevating, so the medial end of the clavicle will be depressing or descending. From the acromioclavicular joint, you can just feel the anterior margin of the acromion process there, and the acromion process continues around across the lateral side of the shoulder. Now, if we ask the patient to place his hand in behind his back and just to relax his shoulder, from the lateral end of the clavicle, I'm going to find the lateral curve of the clavicle, lateral third of the clavicle, approximately the midpoint of the clavicle there, and I'm going to drop down and palpate for the coracoid process of the scapula. And my index finger is over it now. You can see the roundness of the shoulder there, so I'm just in that little depression on the medial side of that roundness. And if we ask the patient just to move his arm around a little bit, you'll feel the coracoid process moving under your finger. Just pop your hand in behind your back again. So in this position, this helps to expose the coracoid process and makes it a little bit easier to palpate. And just relax there. All right, so the next structure that we want to palpate is the bicipital groove. Again, to make this a little bit easier, we're going to ask the patient just to turn his hand out into this position. My middle finger is on the coracoid process. The next bony prominence I feel will be the lesser tubercle of the humerus, and I feel just lateral to that, I can feel the bicipital groove in that position there. So I can place my fingers down approximately in the position of the bicipital groove, and I'm going to ask the patient just to turn his hand inwards and outwards again, and I can feel the bicipital groove rolling down underneath my fingers. And of course the long head of biceps runs down through that groove. All right, so we're just going to turn the patient around a little bit, so I'll get you to face that way. And we're going to now move around and look at the lateral side of the shoulder. Of course, you can identify easily the deltoid muscle covering the lateral shoulder and the upper part of the arm. So if I start just in this position here, my index finger is on the anterior border of the acromion. So remember, the acromion travels around laterally and then continues posteriorly as the spine of the scapula. So just on that point there, I can feel the lateral margin of the acromion, and if I come round posteriorly, I feel a nice sharp bony landmark where the acromion becomes the spinous process of the scapula. So we're just coming around the lateral side of the scapula towards the spine of the scapula. So I'll get you now to face the wall that way. So in this position we can pick up from the acromion process, and if I palpate across the spine of the scapula, all the way across to the medial border of the scapula. So there's our spine of the scapula, and of course the infraspinatus infraspinous fossa is below that with the infraspinatus muscle, and the supraspinatus muscle sits up here in the supraspinous fossa. So if I just get you to put your hand in behind your back. So if we get the patient to do that, we can immediately see the broad outline of the scapula in this position. So if I palpate there we have the inferior angle of the scapula, and if I palpate across the lateral border, so that would come up that way, and then I can also palpate along the medial border of the scapula. Here was our spine, up here to the approximate position of the superior angle of the scapula. So you can see that if you look just at the posterior view of the upper back, scapula sits quite flat against the thoracic cage, and as soon as you put your arm in behind your back, then this helps to identify the outline of the scapula there sitting on the upper back.